Hey guys, Steven here. I was scrolling through some news articles the other day and was inundated with news about the pandemic, the death rates, government response, the recent European shutdown, and the impending possibility of yet another shutdown here in America, and how all of this impacts our long-term health. Clyde, you're not helping at all. Can you sit down? Try this again. The death rates, the government response, the recent European shutdown, and the impending possibility of yet another shutdown here in America, and how all of this impacts the long-term health of all of us. These were the headlines that stood out the most. How have these shutdowns affected the childhood obesity pandemic? Has it made it worse? How could the potential for another shutdown be even more dangerous for our kids? All this and more in today's video. Alright, I'm going to be a little honest with you today. This topic is a little bit heavy. So if you stick around to the very end of the video, I promise I'll leave you on a positive note and share a clip of my two huskies, which you actually already just saw a second ago. Any of my regular viewers will know that I have a team of exceptional lawyers that are chained up down in my basement, and as you already know, they get a little bit rowdy whenever I'm in the studio. And the only way to quiet them down is to give a quick disclaimer. I'm not a doctor, this is not medical advice. If you need medical advice, go talk to a doctor, blah, 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 blah. You get the point. Remember, I'm just some random dude on the internet with huskies that hang out in my studio. Now that all that's out of the way, let's get to the meat and potatoes. COVID-19 is not likely to go away anytime soon. We will probably see intermittent surges of the virus for many years to come, and it will continue to have a lasting effect on both the physical and economic health of our society. For people like us, the chubbier folks, this effect is only going to be magnified. I will approach this topic from two different angles and will split this across two videos. In today's video, I plan on going over a couple of clips from experts commenting on the dangers of obesity and COVID, as well as trying to get into some thoughts on what we can do to protect our children from the threat of this virus and from obesity in the future. The second video will be tomorrow evening, and it'll be on my other YouTube channel, The Stephen Carlson Show. Link will be down in the description below. I hope you enjoy this approach of covering a topic from both the health and finance aspects. Let me know your thoughts, comment down below. So how does being obese put you at an increased risk for the coronavirus? Here's a small clip from Dr. Simon Clark discussing obesity rates and COVID.
Well, we don't actually have a confirmed mechanism for why obesity makes somebody more susceptible to COVID-19. But it does that at all levels. If you're obese, you're more likely to be hospitalized if you have COVID-19. If you go into the hospital, you're more likely to end up in intensive care. And if you end up in intensive care, you're more likely to die compared to somebody who doesn't have or isn't obese.
This is very true. While we're still unsure the exact reason why obese people are more likely to be hospitalized than non-obese individuals, some studies have shown that COVID affects the heart in ways that individuals who are in poor physical and cardiovascular health are a little bit more susceptible to the worst outcomes.
There are a number of potential metabolic reasons why that is. People who are obese tend to be resistant or have some resistance to insulin, so their normal physiology is affected and doesn't work properly. Also, they have a degree of inflammation, and we know that in very many cases it's the overexuberant immune response that causes damage. That's what often kills people, is their own immune response. And if they're already carrying a naturally high degree of inflammation, then that means their bodies can't respond appropriately.
While more research is needed to understand the physiological reasons, honestly, between you and me, the actual detailed process of what the illness does to an obese body really doesn't matter that much. What is essential to us is to know that fat people, we are much more susceptible to having a very poor outcome if we catch COVID. Still, the signs and symptoms of morbid obesity are known. We know that you can reach a certain level in your health where you are most likely to have a wide variety of conditions like diabetes, high blood pressure, inflammation, difficulty breathing, and so much more. All these conditions can not only reduce your current everyday health, but also have a significant impact on the outcome if you do contract the virus. Now it is even more important to start your weight loss journey. So if you've been putting it off for the perfect time, just know that the perfect time does not exist. Start now. Slow, steady progress towards your weight loss goal is key. We all know that we need to work on our weight. What is even worse with COVID is our children are disproportionately affected. Not by the illness directly, but by the shutdowns themselves.
It's a recipe for weight gain. Most extracurricular sports canceled. Children spending more time at home, and many parents distracted by working from home.
The risk for kids gaining weight over the past several months has really gone up quite a bit. And you can imagine in certain populations more so than others.
Dr. Raquel Hernandez says it's not just the lack of activities or unhealthy food choices. The disruption in routine alone can be a factor.
We know that weight in kids is affected by everything from diet and activity to also sleep and stress.
Experts say families should avoid mindless eating or rewarding good behavior with treats, unhealthy habits that could lead to serious health concerns.
It does predispose them to chronic illnesses, including hypertension, as well as prediabetes, diabetes in some kids, as well as heart disease and high cholesterol.
Thankfully, the doctor does have some suggestions to assist parents in protecting their children against these unnecessary weight gain.
Dr. Hernandez says parents can use the 9-5-2-1 almost none formula to help reestablish a healthy routine.
9 hours of sleep is something that we recommend. Having 5 servings of fruits and vegetables per day, as often as you can. 2 relates to the maximum amount of screen time that we would recommend. 1 hour relates to the amount of activity, physical activity that we'd like for kids to have. And then 0 or almost none refers to the sugary beverages.
The sad thing is the very action we are taking to protect our kids from COVID may turn out to backfire. And rather than protecting them, it may doom them to a lifelong chronic health problems due to increased obesity. Don't forget to watch part 2 of this video on my other channel. Thank you very much for watching. Please make sure you click like and subscribe. Doing so really helps the YouTube algorithm. I appreciate it. Thanks, and I'll see you on the next one.
Woo!